Greetings and welcome back. I'm Dr. Kamau Kokayi, and I've been inspired to call these sessions the Kokayi Academy of the Healing Arts, for lack of any better phrase, but you'll decide. Today I want to start this session by highlighting three cases. In these three cases, we had two patients who actually became very angry, and one patient who was actually grateful. The first patient had something called reflex sympathetic dystrophy, which involves a painful sensitivity that reflects an imbalance in the autonomic nervous system, such that one limb, in this case it was her right leg, was so sensitive to touch that she could barely put it down on the ground. She had been treated for about 2 or 3 years with different pain medicines, and somehow she ended up in my office. Actually, by the time we finished, she actually put her foot down, and to her amazement, she was actually better. And basically, I treated her using chiropractic type skills. She had what was called a category 2 pelvis. No need for me to go into details here, but there was a torsion that involved her spine, her sacroiliac joint. And once I did the necessary mechanical correction, she no longer had the sensitivity in terms of her nervous system. Well, she was ecstatic. She was totally, moved. The fact that she could walk, she could put her foot down. This lasted for about 3 minutes. And then she became very angry. She became angry because of all the treatment that she had had from pain specialists, orthopedic doctors that had seen her, and basically she was just given pain medicine and muscle relaxants. So I explained to her that anybody that had graduated from a chiropractic school probably would have been able to fix her in one visit. And so that's the first case. Second case involved an 8-year-old child who was on multiple medications for attention deficit hyperactivity disorder. We might as well say attention deficit hypersensitivity disorder, because in this particular child, and I remember the first day that he was in my office, he was literally nodding out from the type of medications that he was given, a lot of sedative type medication. And he was seeing a psychiatrist, and the mother was she didn't know what to do, because now from being hyperactive to falling asleep in class, well, the child was basically falling behind at 8 years of age. So through some simple biochemical testing, we identified that the child had gluten and dairy sensitivity, and sensitive to a number of foods, and probably food colorings as well, which was a big deal. But needless to say, the child changed their diet, the parents changed the child's diet, the child woke up, they got off the medications, and they were ecstatic. But then came the anger. Anger, why? Because the child had been to the pediatrician, had been to an allergist, had been to any number of folks trying to figure out what's actually going on. And the most that happened is the child was given this medication. No one had really looked at this type of food sensitivity testing that helped to reveal what was going on. No one had explored the idea of gluten sensitivity or food coloring as being something that was contributing to this child's behavior. So, in fact, this parent actually sent me a bunch of patients after that. But the point is, for this presentation, is that this parent was particularly angry because something hadn't been explored that would have made a big difference for her child. And in the third case, we have someone that had, let's say, a mood disorder. This was an 18, 19-year-old adolescent brought in by the mother, basically sullen, had been sad and really depressed for a while. They hadn't sought out, I think they had seen one other practitioner, and medication had been recommended, they decided not to do that. So basically with this client, I did a session of pranic healing. What do I mean by that? I did a session that involved rebalancing the person's chakras and energy field. And literally, I did not touch the client. And I did different types of sweeps, just cleaning different parts of his energy field. And after a few minutes into that, he started giggling, right? And he just started smiling. We went back to the room. He says, I'm not depressed anymore. I feel fine. And they looked at me. I think an expression that I hear often that's used in my office is witch doctor. And I mean, that's a very pejorative statement, but people don't realize that in this culture, so they'll throw out witch doctor. Perhaps if I were a Native American, they would have said shaman, or if I was just Caucasian, they might have said I'm a light worker. But anyway, that term was used. And I bring this out to say we have 3 cases here. They weren't angry at all, you know, but what happened is they were exposed to something that was outside of their cultural reality. So they had to frame it some way. Something that was just really removed from their cultural reality. In the first 2 cases, it involved me doing things that were within a cultural framework that people understood. The point here is that allopathic medicine came up short in all 3 cases. And many of y'all might say, well, these are just 3 cases. But I guarantee you that this is my practice. And this is a practice of many people around the country. So it's not just about, you know, that these are just 3 cases. But the issue is that allopathic medicine, because we're kind of working in a scenario where we're looking at the earth as being flat. We're looking at the body as just being a biochemical, biomechanical reality, when the truth is the earth is round. And the truth is that human beings are much more than what's being defined within an allopathic medical framework. So much so, in terms of limitations of that framework, that in some cases at this point, people are actually being harmed. And in other cases, people just aren't aware of other cultural realities. Now, in my looking at things, all medication or all systems of medicine are cultural applications. They're cultural applications because the way that people are trained to think, to view illness, to view the world, ultimately impacts on how they develop systems of care, of healing, of medication. For instance, if you are learning how to practice Chinese medicine, well, you're going to learn about meridians. Meridians are electromagnetic field realities in the body. They're not biochemical per se. You're going to learn about pulse taking, which deals with an energetic vibration and interpreting that. Totally different in terms of diagnostics. If you're a practitioner of traditional African medicine and you've had some authentic training, well, you've had to demonstrate that you're actually psychic. Or you've had to demonstrate that you're proficient in the use of oracles. In oracular, I had one practitioner that used oracles, called it her floor x-ray, right? And literally from throwing the bones, she was able to get a picture of the reality of her client and actually, you know, advise them on that. So these are other cultural realities that lend themselves to technologies that are foreign to here. But we have a tendency of either not using them because they haven't been validated by Western science. But I want to point out that Western science is having its own problems right now. And when I say Western science, in part, I'm talking about the the root of Western epistemology, meaning Western way of framing reality, which is physics. If we look at theoretical physics, there was a time that everything came down to the atom. The atom was the physical unit, the base unit that gives rise to everything else. But now they realize that the atom, what we're calling particles, whether we're talking about protons or neutrons that break down into quarks and held together by gluons, or electrons that are photons, that if you were to take, for instance, a single carbon atom, what's actually material in that atom, what's actually material and what's actually space, right, in terms of these statistical planes that the electron is moving around in, and the space occupied the proton and neutron, there's 1 part matter for 500 trillion parts of space. Let me say that again. 1 part matter to 500 trillion parts space. Now, you're sitting there, you're saying, well, I'm physical, you know, this world is around us, but what's happened is consciousness coming through you, coming through our bodies, is limited. It's limited in terms of what it can actually perceive, right? It's limited on a number of levels. Just in terms of the electromagnetic spectrum, we deal with visible light. Maybe we can deal with sound, infrared, ultraviolet, gamma rays. We're not checking out any of this stuff. And then what is the deal with this void, which you might look at as the infinite potential of this unobservable energy matter out of which everything else comes? You might play that back just to catch what I said. But the bottom line is there's a whole lot out here that cannot be explained just using one cultural paradigm. And that's the point. So what we're going to do in subsequent talks, we're going to begin to break this down and look at ways to actually access this other than conscious place, and to see how that actually plays a part in healing, right? And also expand our biomechanical and our biochemical models of health and disease. So I hope you join us again when we have another segment.